Hi again. I'm going to talk a little bit about lifestyle modifications in regards to not just preventing hypertension, but once you have hypertension and you're being treated with medications, continuing these ongoing lifestyle modifications, which are pretty life term in regards to modifying your lifestyle. Number one, I find a lot of my patients that have high blood pressure are smokers. So those patients really need a lot of education and motivation to stop smoking. There's different types of ways of dealing with that. Some patients, use nicotine patches. Others take oral medications that can be prescribed by their physician to stop smoking. It's a lot of self-motivation from the patient standpoint to stop smoking, but there's things that the provider can do to help that patient stop that bad habit. The second one is inactivity. So I try to get my patients motivated to develop a regimen of exercise where I try to get them to exercise at least minimum of 30 minutes a day, either walking, or if they want to do more extreme exercise, they can jog or even do sprints. So being inactive, again, it's a high risk. We try to change that lifestyle. Another one, a lot of my patients are overweight. We tend to use this criteria, body mass index. Over 35 usually is obesity. If it's over 30, it's also being overweight and obese. So any patients that fall into that category of high BMIs or overweight, I try to get them into a dietary program with a professional dietitian if I can get a referral to one, which I normally do, and try to get the patient into a regimen of eating more vegetables, more fruits, cutting back on their salt, cutting back on their fat intake, because losing weight has shown to be a good way of decreasing your risk of having high blood pressure. The other thing that I try to motivate patients with is they have diabetes, and a lot of my patients with high blood pressure have diabetes. Obviously, get them complying with their medications and get their sugars under control. And again, I try to tie in all the modifications that I mentioned previously into the whole gamut of how I treat my hypertensive patients. Lastly, I try to motivate my patients that drink excessive amount of alcohol. For me, I would say more than 4 drinks a day. If those patients drink that much, I try to get them to understand that definitely increases their risk, not only of high blood pressure, but other comorbidities such as developing liver problems and other complications of alcohol. So motivating those patients to stop drinking is a priority for me when I treat my patients with hypertension.
Medtwice.com